All right, I'm Leanne Flowers, and I'm a nurse practitioner student at Auburn University. Today I'm going to be showing you how I do my physical assessment. For the purposes of this video, I've already had my patient empty their bladder, and they've already had their vital signs, including height and weight for BMI, taken by the nurse, and also they've had their visual acuity taken, which showed cranial nerve 2. So once that's done, I'll come in, introduce myself to my patient, speak with them a little bit, get their mental status, and do a general survey. How are you doing?
Good.
Okay. So first I'm going to just notice that generally overall she's in good health. She's not having any trouble breathing. Work of breathing is good. Skin color is good. General weight and health looks good. So then I will go into the portion where I begin my assessment. I'm going to start with the head. I'm going to inspect the head and palpate the head. So I'm inspecting, making sure that the hair is not coarse or brittle, making sure there's no dandruff or just any infestations or anything like that. And then I'm going to palpate the head and make sure that there's not any kind of lesions or bumps on the head. So after I've completed that, I move to my face. I'm going to evaluate the face. We're looking for symmetry. We're also looking to make sure that the movements are equal. Can I get you to raise your eyebrow? Okay, and smile, and then frown and puff out your cheeks. Okay, so cranial nerves 3, 4, and 6 are intact. And the face and the head looks good, so I'm gonna move now to my eye exam. I'm gonna begin with an external exam of the eye. I see that her pupils are equal, 2 millimeters. Her sclera is white. There's no drainage noted or anything like that in the external portion of the eye, and it looks good. Then I'm gonna go and I'm gonna assess the inside of the eye with my ophthalmoscope. So what I'm gonna do is I'm gonna be assessing for the retina. I'm also gonna be assessing the optic disc and making sure the nerves come to a point at the optic disc. I'm also looking for the macula. So I'm going to shine this light in your eye. I'm also going to go ahead and do a corneal reflex, and so I'm going to shine this in the middle of your face, and I'm just going to look for unitalization bilaterally in the pupils for the corneal reflex, and then I'm going to look inside the eye. And I'm going to just do one eye for the purposes of this video. I'm looking for the red reflex, and I see it, and I'm going to go into the eye. Okay, and so once I have done that, I've checked the internal and the external portion of the eye. I'm going to check my visual fields for via confirmation. So I want you to cover your right eye, and I want you, and I'm going to close mine, and I want you to tell me when you see my fingers.
Now. Now. Now.
Okay, we're going to do the other side. Okay, so peripheral vision is intact, and now I'm going to complete my eye exam with checking the pupils for perla, making sure they're equal, round, reactive to light, and accommodation. I'm also going to do my 6 fields of gaze, and that's going to check cranial nerve number 3, 4, and 6. All right, so I'm just going to have you look straight forward. I want you to watch my pen light, and I'm going to go out and come in. Now I want you to follow it. Okay, so that eye exam was normal. Once I've completed the eye exam, I'm going to move to the ear exam. I'm just going to take, I'm going to do this for the purposes of this video. I'm doing only unilateral if there's 2 body parts. So I'm going to look at the outside of the ear. I'm looking at the auricle, making sure that there's no tenderness on palpation when I palpate. And then I'm going to get my otoscope and I'm going to look on the inside of the ear. When I do my assessment on the inside of the ear, I'm looking at the tympanic membrane. I'm looking for the pearly gray color. I don't want to see any bulges or perforations or earwax buildup. So I'm just going to take a look right here in your ear. Alright, and so all of that is normal, as to be expected. So I've looked at the external portion of the ear, the internal portion of the ear. Now I'm going to check hearing. I'm going to do a whisper test. I'm also going to do the Weber and the Rhine test. The whisper test, I'm going to say 2 words to you and I want you to repeat them.
1, 2.
All right, so we're going to just do that unilaterally. Now I'm also going to do the Weber test. At this point, I'm checking to see if you have hearing in both ears. I'm going to strike this tuning fork and you let me know if you hear it in 1 ear or 2.
2.
Okay. Now the next part is the Rhine test, and I'm going to strike this tuning fork and I'm going to put it on the mastoid bone. I want you to let me know if you hear, when you stop hearing it. I'm going to put it to the side and you let me know when you stop hearing it. Okay, so the air was longer than the bone conduction, so there was no conductive hearing loss. And that was cranial nerve number 8. So once I've done the hearing and the ear assessment, I'm going to move to the nasal and the nose. I'm just looking on the outside, making sure there's no obvious deformities. I'm going to eliminate the inside of the nares, and I'm going to look for any drainage or obstruction and make sure that the turbinates are good and that everything looks good with the nose. So I'm going to check for patency. I want you to occlude one there and breathe on the other side and then do that side. Awesome. And then I want you to close your eyes and I want you to tell me what you smell. Orange. Okay, so cranial nerve number 1 is intact. And that concludes the assessment for the nose. Then what I'm going to do also is I'm going to move to the mouth. I'm looking on the outside of the mouth, making sure that the patient is hydrated, there's no dryness. I'm going to look on the inside of the palate. I'm looking at the teeth. I'm looking for any signs of infection, such as yeast buildup along the palate and the mucus. I'm also going to look at the back of the pharynx. I'm going to look for any redness or swelling. I'm going to look at the tonsils and make sure they're not swollen. And then I'm going to just look under the tongue. Can you open your mouth? All right, no redness, tonsils are +2. That's a normal finding. After I do that, I want to go ahead and check for cranial nerve 9 and 10, and I would have a tongue depressor, but for this purpose I don't. So what I would do is I would insert it into the patient's mouth, have her say I, and the uvula would be midline, that would be 9. I would check for gag reflex, and that would be 10. And so those are present. Now I'm going to have you stick out your tongue, go up and down, side to side, and that's cranial nerve number 12. Now, to finish this up, I'm going to do cranial nerve number 11. I want you to shrug your shoulders up and down, and then try to resist my hand, and then this way. And so cranial nerve number 11 is intact. Then I will go from that point, I will start to assess the neck. When I assess the neck, I'm looking for overall symmetry, making sure the trachea is midline. Once I've done that, I'm going to palpate my lymph nodes, and I'm going to start with the auricular, postauricular, the occipital, tonsillar, mandible, submental, and then I want to do cervical and supraclavicular. So once I've assessed and made sure there's no swelling or tenderness of the lymph nodes, I'm going to come around to the back and assess the thyroid. So once I'm in the back of the patient, I'm just looking for overall symmetry of the patient's back. I'm looking to see if it is even. I'm going to just palpate just to make sure there's no tenderness. I'm going to place my thumbs at the 10th rib, have my patient take a deep breath, in and out, and that was symmetrical movement. Now I'm going to check for tactile fremitus, and the way we do that is if there was increase in tactile fremitus, there would be consolidation. If there was decreased tactile fremitus, it would mean fluid on the lungs. So I'm going to say 99. I mean, you're going to say 99. When you feel my hands on your back, each time you're going to say 99, okay?
99, 99, 99, 99.
All right, and so that was a normal finding. And after I do that, I'm going to percuss the chest. I'm percussing for resonance to make sure there's no dullness or fluid in the chest. So I'm just going to percuss. Okay, so on percussion of the chest, it's resonant, and I also now want to auscultate the chest. I'm auscultating all lung fields with both the bell and the diaphragm, but for the purposes of the video, I'm only going to do the diaphragm. Can you take a deep breath in and out? Okay. So then once I've done that, I'm going to move around to the front. I'm going to complete that assessment on the front. I'm going to look at AP diameter, making sure it's even. I'm palpating for tenderness. I'm going to do tactile fremitus again.
99, 99.
All right, and then once I've done that, I'm going to, again, I'm going to percuss the front of the chest and also auscultate the front of the chest with both the diaphragm and the bell, but for the purposes of this video, I'm only going to do the diaphragm. Of course, you would want to hear resonant sounds. I'm gonna take a deep breath. Okay, and so once you've completed the respiratory assessment on the chest, you want to move into your cardiovascular assessment. I'm going to begin just palpating, making sure I don't feel any heaves or thrills, and then I'm going to palpate the point of maximal impulse. All right, then I want to move into listening to my heart. So when I'm listening to my heart sounds, I'm listening for S1 and S2, making sure there's no splitting, S3 or S4 murmurs or clicks. I'm going to listen to each portion of the chest in a Z pattern, and I'm also going to make sure that I listen with both the bell and the diaphragm, but for the purposes of this video, it's only going to be the diaphragm. And I'm going to complete that now. I'm going to do aortic, pulmonic, herbs, tricuspid, and mitral. So like I said, I would do that using both sides. I would also have the patient lean forward and complete that again, and I would have them lay back and lay on their left side and complete that again. But for time, we're going to overlook that right now, and I'm gonna have my patient lay back on the bed. Okay, so for the purposes of this video, I'm checking the patient. We're going to move into the peripheral vascular portion. I'm going to check jugular vein pressure, and I'm going to look at my patient's neck, and I'm going to increase the bed to 30 degrees until I notice it. Once I notice the jugular vein, I would measure that by going from the top of the vein out to the sternal notch, and 3 to 4.5 centimeters would be normal. So once I have completed the jugular vein pressure, I would then do my peripheral vascular assessment. For the purposes of this video, I would palpate all of my pulses and also auscultate over them for bruits, and I'm only going to palpate one side and identify the landmarks and verbalize that I would also auscultate. So I would like to check the temporal, the carotid, and the brachial, the radial, femoral, popliteal, tibial, and pedial. And I would again auscultate over those to make sure there's no bruise. So once I've done that, I'm going to move into the portion of the test, the exam, where I'm looking for peripheral vascular disease. So I'm looking at the extremities, making sure there's no edema, no skin color changes on the legs, no loss of hair, or change in skin color. I'm also just doing a general assessment to check for that. Once I do that, that completes the peripheral vascular check, and I'm going to go into the abdominal check. So I'm going to check the abdomen just overall. For the modesty of this video, we're keeping our clothes on, but we're going to verbalize a lot of this. But I would expose the abdomen. I would look at the contour of the abdomen. I want to see if it's round, if it's flat or sunken. I want to see if there's any obvious hernias or abnormalities. And when you get to the abdominal portion, you want to auscultate before you palpate or percuss, just because it can affect your sounds. And so I'm going to take my stethoscope. I'm going to auscultate over all 4 quadrants of the abdomen, also the epigastric and the aortic areas. And the epigastric and the aortic. So once you've auscultated, now you can lightly well, actually I'm going to percuss. I'm going to percuss over the abdomen, looking for like the spleen and the liver, and making sure there's no excess fluid. So once you do that, you can lightly palpate the abdomen. You're lightly palpating for any tenderness. You're looking at your patient's face, making sure they're not having any grimaces, and you're also just just looking for any masses or anything like that. You can also check for rebound tenderness, and then you can move to deep palpation. You can deeply palpate to make sure you don't feel the spleen or the kidneys. And then you can check for palpation of liver. You put your left hand under the 11th rib. You put your right hand under the dullness that you percussed on the liver. And then you have the patient take a deep breath, in and out. Okay, and then you just make sure that you can't palpate any enlargement of any of the organs. And so then once you do that, I'm going to move into the musculoskeletal portion of my exam, just because my patient's already laying down. And so I'm going to just go ahead and lay them just a little bit flatter, just so I can check for extremities. And what I'm going to do is I'm going to check range of motion, strength, flexibility in the joints. So I'm going to have you lift your leg up, and then bend your knee, and then put it down. And then I want you to come up with your knee and then cross over and then back up this way. Okay? We're going to repeat that on this side. Bring your leg up, down. Okay, sorry. And then bend your knee and then bring it over, and then that way. Okay. While I'm down here in this portion of the test, I would also just go ahead and check for strength. Can you push and pull? Muscle strength is good. I would check a Babinski right now just while they're laying. And then I'd have you go ahead and sit on the side of the bed. Okay. So now I'm going to do the upper part of the musculoskeletal system. I'm going to have you tuck your chin to your chest and look up. And then I want you to go side to side and ear to shoulder. Okay, I want you to lift your hands up in the air and put them out to the side and then down. We put them behind our head, and behind our back. And there's no pain or anything in any of those joints. Now, I also want you to grip my hands, and I want you to put your arms like this, and I want you to try to pull. So strengthen everything that's good in the upper body, good range of motion. I'm now going to check for sensation. So I want you to tell me if you feel any, if you're feeling something sharp or something dull, and I want you to close your eyes. All right, so sensation is intact. Now also, I want to go ahead and check for a couple other things real quick. I'm gonna put an object in your hand. I want you to see if you can identify it. Close your eyes. All right, close it.
Coin.
Okay, so she was able to do that. Now I'm also going to get you to take your fingers and touch each thumb. And put your finger on your nose. Now touch my finger, both sides. Sorry. Okay. And then I want you to take your hands and I want you to turn them fast like that. All right, now I'm going to have you stand and I'm going to have you bend over, touch your toes. I'm going to assess the spine at this time and then stand up and walk heel to toe. That's good. And then can you turn around and walk back on your tippy toes? Okay, that's good. I'm gonna have you sit down. Now the last portion of this assessment is I'm gonna check reflexes, and so for the purposes, I'm only gonna do unilateral, and I'm gonna identify them and check the reflexes for the video. So I'm gonna do bicep, tricep, brachial radial, patellar, and Achilles. So that concludes my head to toe assessment. Thank you.